Within the North East, the public sector is a huge employer, if not the biggest.
There's always going to be a need for healthcare. There's always going to be a need for people to make people better.
It is the best job in the world. It's the most rewarding job in the world as well.
If I'm honest, I was sort of inspired by the Ghostbusters. They were scientists and they were my heroes growing up. Them and Wile E. Coyote.
My name's Claire Turney, I'm 34, I work at the RVI in the Medical Physics Department and my job is a Senior Medical Technologist. I love this job because I get to see a varied amount of people every day. Every day is different.
We'll test your left eye to begin with.
Well, that's my best one.
Yeah. We have to do various diagnostic tests to try and find out why this patient's having visual problems.
Just try and keep those squares nice and sharp and in focus.
I had the basic GCSEs. I then did 3 A-levels, 2 sciences and English language, and then I did a degree in physiology. I would definitely advise to get your basic qualifications, your maths and your science. You need them, and once you've got them, you're going to use them in every single job you're going to do.
I'm Kat Chignall. I'm a student paramedic with North East Ambulance Service and I'm due to qualify as a paramedic at the end of the year. To be a paramedic, you need to be over 21 for the driving side. In addition, you need your English, your maths and your sciences.
How long did you do that for?
For 2 minutes. You now have to do your foundation degree in paramedic science. I do the 12-hour shifts like any other ambulance crew. But I also, on my rest days, have to study for my degree, which is a 2-year degree, and then in a year or so's time I'm going to go for doing my BSc in emergency care. Paramedics do go fully in depth into the whole anatomy and physiology of the human body, so even if you do human biology, that would be great. Maths, because you've got to calculate drugs, you've got to calculate weights and tube sizes and a whole vast range of things. For the 12 hours you're on shift for, some days it's a really long shift, but it is the best job in the world.
My name is Trevor Foster. I am 32 years of age. I work as a paediatric audiologist at the James Cook University Hospital. Oh, nice, Mr. Lion. Are you going to hug him? I like the job so much because we get to spend a lot of time with patients. We get to assess children's hearing from babies and we see that patient right through until they're 18 years of age. So not only do we get to treat and diagnose problems, we get to manage that problem as well. And that I find is really, really rewarding.
Good boy. Oh, doggy.
There's lots of different routes into the profession. Several of my colleagues came directly from school. Some come directly from A-levels. There's people who've done a BSc, there's some people who've done an MSc, and we all work together. We all do a very similar job. There's lots of ways of getting up the career escalator. You don't necessarily have to have been to university and got a degree. There's other ways of working your way up through the system. Make sure you get your maths and your sciences, for me, are things that can be applied, can be used in most industries and most professions. So I'd say they're the core ones that you need to concentrate on.
My name's Graham Taylor, I'm 27 and I work in the haematology department at the Royal Victoria Infirmary as a medical laboratory assistant. The job is basically to assist the biomedical scientists in providing whatever service is needed for the patient. Processing of the tests, as well as issuing of results, and if necessary, issuing of blood products which will be given to patients. I mean, actually coming into the job, all I had was A-levels, whereas now I've got a university degree. I was given the opportunity to do a foundation degree in healthcare practice at university and have since completed it. It also means that should the opportunity to do the biomedical science course ever arises, it counts as a year of that course. It means you can go from being a medical laboratory assistant to associate practitioner to a biomedical scientist and then on from wherever that leads.
Within the North East, the public sector is a huge employer. Career prospects are really, really good.
There's always jobs available because unfortunately people always get sick, so there's always the 999 route needs covering.
There's a huge amount of job opportunities out there. If you find a niche that you love and you can get there, then that's it, you're set for life.